Resipilana, as I greet Dr. Abel Tlailani. It's 2024, Dr. Abel. How are you?
I'm fine. How are you,
I've never
Wendy?
called you Dr. Abel, ne?
Yeah. Well, you see Dr. Papi, Dr. Evil, Dr.
Hey,
Tailani,
hey.
Dr. T, everyone.
Maar dit is 'n spesifiek met Dr. Tlailani vir ons.
Yeah,
Ja,
that's
op
right.
Radio Kansel, dat is Dr. Abel Tlailani vir ons.
It's good to be back and in this beautiful studio
Ja,
and nicely air conditioned.
ja.
Thank you very much. I just want to greet the family out there and say greetings. And then I'm looking forward to a prosperous 2024 with you guys.
Amen to that, especially prosperous in our health. Yeah. Paul says, Apostle Paul says, we should prosper in all things, but even as in our health.
Yeah.
So we need that in 2024.
That's right.
And I have already asked you, family, to can send us a message, our WhatsApp line, 082 657 2729. It's 082 657 2729. And our SMS line, 37871. 37871. You can send us a message and allow us to know. Let us know what you'd like us to discuss in 2024 as we will continue to be talking about the checkups. We are talking about the checkups with Dr. Tlailani today. And our gogos have to go for checkups. Our moms have to go for checkups. We young people and Bontate, we never count ourselves in, Dr. Tlailani, where the checkups are concerned. We take everyone.
Yeah, everyone.
But not us.
Okay.
So when we're talking medical checkups, what are we referring to?
Can I just start with something concerning that umama lobeka kwatile kakhulu.
Yeah.
If you check on Hosea 4:6,
Asambe ku Hosea 4.
4:6.
Uh-huh.
Yeah, it says, "My people are destroyed for lack of knowledge, because thou hast rejected knowledge." If you don't want to learn, you don't want any knowledge to be impacted into you, you are going to perish.
Ish.
That's why it is said that my people perish because of lack of knowledge. So we have to diversify. Any radio station has to diversify. You have to see. You've just been speaking about those 7 mountains and everything. So
we need to conquer them from God's perspective.
From God's perspective, that's right.
Wow, that is so awesome.
And one other thing I can say is that when it comes to health, health is the most important investment or wealth that everyone has to take care of. It does not matter your race, your money,
as you're saying this, Dr. Tlailani, I'm reminded that registered nurse Lufunone Kota was saying to me, you don't eat, you don't sleep, which is really not good for you. Health is your wealth.
It's your wealth, yeah. And there's nobody who's going to take care of it like you have some financial advisors who will take care of your wealth. There isn't a financial advisor or a wealth advisor except you yourself. You have to take care of yourself. You have to take it in your hands that you see a doctor every year or any other time that, depending on what illness, you're prone to get, things like that.
Do you have to even wait to know which illness are you prone to get?
No, you don't have to. That's why we're going to talk about
the checkups.
The checkups, yeah. Those are very important. Sometimes you go for a checkup for a specific thing, yearly, or 3 months, 3 yearly or 5 yearly, depending on what type of a disease that you could be prone of. If you have been classified under some other category of a program, maybe you have got a family history of cancers, a family history of hypertension, a family history of diabetics, then the doctor will describe to you, okay, come yearly, every 6 months, every 3 months, or, 5 yearly. Now, why we have to have this checkup is because we want to see these things while they're still far. Because
attack them whilst they're still far.
Attack them, yeah. Because as long as you see a disease or you see signs and symptoms of a disease, you are able to combat it or you are able to can treat it when it comes, or you can avoid having to acquire it. It's just like we've got different illnesses like diabetes, hypertension, high cholesterol, renal failure,
Ish.
things like that. All these metabolic disorders, we can pick them up. Now, it's my advice that at least every year, go and see your doctor. Now, your doctor will do some couple of tests after he has done a physical examination on you.
Now, there's a period with our children
Yes.
when they're babies and they're toddlers and they're children. There's that period where we take them to the clinics just like that, for vaccination
Yes.
and.
Yeah.
Even just to weigh them.
Yeah.
No, they're weighing right.
That's right. Yes.
Then they get to their teenage years.
Yeah.
What should be happening there? Because none of us is talking about checkups where teenagers are concerned. Or is it because they have the growth hormone and so they heal quicker and we can't detect these things? Or we wait until the child looks sick and then we discover, diabetes type 1 or something. Or when should we be, what should we be doing with teenagers?
Okay, let's start there where the child has to go for this
Vaccines.
and everything.
Yes.
Those are mandatory, and the government
Compulsory.
compulsory. And then now that's where at least your primary health care starts. You're going to start now blocking all these illnesses that will be coming to you, like the diphtheria, which are going to involve your lungs. The tetanuses that are going to involve your muscle, like having to develop epilepsy or something like that, like the whooping coughs and other things. So that if when you grow, as you get exposed to whooping cough, for instance, if you have been immunized, the severity won't be as much as
Yes,
when
you're-
been. So if it attacks you, then you'll be on the safe side. Then treatment is going to be easy.
But now,
as you
we vaccinate until 12 years.
yeah. Now, remember the immunity will be very low. That's why you need all this.
Okay.
But once you reach teenage age,
13.
your immunity becomes more matured. The lymph nodes are more matured. The liver is more matured. And the kidneys, which manufacture some other hormones, are also very matured.
What about the tonsils?
Well, the tonsils, unfortunately,
Because I've heard, no, they're still growing. They need their tonsils.
yeah, okay.
So we don't take them out even during tonsillitis
Okay, but
unless
there
it's
is
worse.
there is a different school of thought.
Okay.
That is the time to take them out when they worry them. But they only take them out if they worry you for at least 3 times in a year.
Okay.
If you get attacked for about twice or once, you don't have to take them. You'll be on oral medication or whatever treatment they'll give you, maybe IMI or IVI. And then you'll be out of the woods. But once they attack you for more than 3 times a year, then you have to take them out. Now, the thing is, at that age, we know that other immunity organs, like the lymph nodes, the liver, the thyroid, they are not well developed yet. But after that period that you have taken your tonsils, they come up. And that's when you develop more immunity. You wouldn't be needing them anymore.
Okay.
And then there's another myth that adults shouldn't be taking out tonsils.
Yeah. Yeah. Yeah.
But that's a myth.
Okay.
If they worry, you have to take them out.
It's
Otherwise
just
they'll
like
choke.
It's just now with measles, because I've heard also that adults shouldn't even have measles.
Yeah, ideally you shouldn't be having measles. Because
Ideally.
your immunity is very strong. It can attack it anytime. Now, in a baby, the immunity is still immature. You have to vaccinate, and potentiate, that the immunity so that the child doesn't succumb to the measles. You can still get measles as an adult, but it won't be as severe as when, in a child.
In a child.
Yeah.
All right. So with teenagers, how often should we be taking them through to be seen by a doctor?
Like yearly, just like an adult.
Oh.
Because we never know if there are any inborn errors of metabolism during development in the womb, which is delaying to manifest, or is got a genetic predisposition of a certain illness. So it's very important that you go and see the doctor every year too, and then they'll do exactly the very same test that we perform
Oh,
with an
right.
adult.
All right.
So they're not excluded.
Yeah, they're not excluded. We think they are because, hello, Dr. Tlailani, which parents bring their children yearly to you?
No, very few. They
Especially
wait until they're
teenagers.
sick.
Yeah,
Yeah, they wait
and
until
then
they're
like, oh,
sick.
doctor, we don't know. Wait, he started by vomiting.
Yeah. No, but I think it's very important that every year, as a teenager, go and see a doctor.
Okay.
Doesn't matter how healthy you are.
Okay.
It's just to do those basic tests. When you come there, they're going to take your blood pressure.
Uh-huh.
There are, we have to do a blood pressure even in a teenager.
Mm-hmm.
They are going to check your urine to see if there aren't any leukocytes, proteins, or anything. They'll take some, finger prick blood sugar.
Okay.
That's when you are going to pick up if the child is developing
Diabetes or
yeah.
not.
Yeah.
Uh-huh.
And then there'll also be a cholesterol, but anyway, cholesterol is not so much of a problem with teenagers and adolescents.
Mm.
And then in a case of an adult, well, we're talking teenagers, isn't it?
I asked about teenagers, yes.
Yeah,
So
okay. I think those are the basic things that you'll have to do.
so no HPV, no
No, don't do that.
no pap smear,
No pap smear. No. You don't do that.
no prostate.
No prostate. Yeah.
What are the chances? What are the odds?
Well, the odds we will see. Let's say maybe breast cancer.
Okay.
Right. With breast cancer,
Yeah.
the odds are so much that if you have got a family history,
Yeah.
you are likely to get breast cancer.
All right.
If you have if anyone in the family has suffered from maybe endometrial cancer, ovarian
Yes,
cancer,
yes.
or cervical cancer, the odds are that you will get cervical cancer. Say in a man now, if you've got a brother, an uncle, or first generation relative, male, who's got or had succumbed to prostate cancer, yeah, you are likely to get it.
So do we check those teenagers? Not yet.
No, not yet.
Around their 20s?
Around that 2021.
All right.
Then we can start doing it, because within a pap smear we also do it from age 21.
Now, if a teenager shows with bloody urine,
Yes.
as a young man,
Yeah.
the urine the stains of blood, and they experience UTIs a lot.
Yeah.
So, what kind of checks or checkups should they do, or what does it mean?
Well, usually,
Because somebody said that could be, or it could be showing you that young person is prone to prostate cancer.
No.
Oh, okay.
Not at that age. The commonest thing which causes blood in the urine at the teenage level, it's infections. Because,
And in young adults?
it's the same. It's
Okay.
infections. And a young adult, how old is a young adult? 21, 22?
Let's take them from 22 to 35.
Yeah. Well, for a man, prostate cancer it's unknown at that age. So we won't worry. We know that
We don't
prostate
worry
cancer,
about
yeah,
prostate at between 22 and 35
and 40, let's put it
and
that way.
40.
Yeah.
All right.
So we won't worry about that. But what we have to do is just to check if there are no infections. And then if you don't pick up any infections, the blood persists. And then you have to do a cystoscope to check inside if there aren't any erosions. Because sometimes some children don't drink enough water. And then what happens is they form stones. And then those stones can migrate from the kidneys down the ureter into the bladder and then irritate the bladder. And then they're going to get that.
Are they
irritable-
almost like what the doctors would call kidney stones?
That's right. Exactly that.
Aye.
Yeah. You can easily get that. So that's one of the commonest causes of blood in the urine,
Okay.
especially at that
So
age.
if they keep having these infections, even if there's no blood,
Yeah.
but now there are more UTI,
That's right.
what kind of checkups do they need? Or
No,
what can we suspect? Still.
Still, just do a urine test and then do a cystoscope if you can't find anything.
All right.
to explain that blood.
All right, let me greet Frank Jacobs. Hello to you, saying good morning, my sister. Good morning to the entire family and our guest. That is you, Dr. Tlailani.
Thank you.
Love the show. Awesome, awesome, awesome. Thank you so much, Frank, for that. And Shalom J, good morning. Am I talking to Shalom J for the first time this year? I'm not sure. You know, earlier on, I was acknowledging our family members who tune in. I forgot Frank Jacobs. So, Frank, sorry for that. Hello to you. We are grateful to always have you. And Shalom J as well. And she says, concerning teenagers, okay, my youngest is 13 now, and since he started puberty at 11, it is a struggle to stay awake during the day. He is constantly tired and he sleeps for 3 hours during the day, and he still sleeps from 9 up until 5 a.m. What could be the cause and solution? And for tonsils, we use Tonsillite from a natural product for a year, and never had a problem afterwards. Oh, that's awesome. That's awesome. So in this case of fatigue, I don't want to call it chronic fatigue yet.
Yeah.
Yeah.
Well, this is more of a pediatric challenge, and then I won't really give a very conclusive answer to this. But
So it needs to be investigated.
yeah, it needs to be investigated. If he's got these recurrent episodes of tonsillitis, I
Yeah.
would suggest that they should be taken out. He's still young, 13. He'll grow and then develop his immunity from other parts of the body.
Now, how does that connect with the exhaustion and
Well-
sleepiness?
Well, remember, tonsillitis can cause, especially if it's recurrent like this, it causes a chronic inflammation. And then your whole body, once it's inflamed, then the lymphatic system is going to be activated.
Yeah.
And then once that is activated, then it's going to exhaust your whole body. And then
Yeah.
you're going to present with fatigue, lethargy, loss of interest.
But now she says they had that one. It was once and never again afterwards.
Well, I think then they should just observe and see what happens. What I can advise is that let him get maybe something like a supplement.
Okay.
I know there is lots of supplements in the market to give them, and then I hope he's seen a doctor.
Okay.
Yeah.
And I remember you mentioning the different kind of supplements, and you say some don't have enough of. That's why you would need a doctor to tell you what you
What to
need
do.
to
Yeah,
supplement.
that's right.
Because we buy those ones with many colors, red,
Yeah.
blue, and then they say this is iron, magnesium, and so little small
Supplements
but you don't get a full supplementary, and you might find that what you need is magnesium. That's all, and
Yeah,
then
that's right.
so get
But
to see a
for
doctor.
children, usually I would recommend that omega-3 is very important.
Ah,
And then vitamin D and zinc plus magnesium maybe.
yeah.
Those are the four which are
Is
very,
there
very important.
is there another way of taking omega-3? Because it's those big.
But they're so nice and smooth. You just pass through
No.
with no difficulty at all.
You're traumatized first by what you see.
Drink them in the dark. Then. Don't look at them.
Let's take a break and then come back to talk to Dr. Tlailani Samote. There's a Besukme, Dr. Tlailani.
Sure.
And do remember that you can even send us what you would like us to discuss in 2024 as we continue talking about the checkups. And you can ask him on any medical issues that are there. He is here to respond to you. That is Ace Besuk. Giving you the sounds of Praise Peterson. Hallelujah. Hallelujah, Yahweh is the song.
Sandumise rhoqo ngecawe ngo-5 o'clock ekuseni no-Ayanda Nenemba. Siyathandaza, siyadumisa, sitya ilizwi nobungqina kuKristu. Let's praise him ku-Radio Pulpit 657 AM.
Skuld is 'n sensitiewe onderwerp vir miljoene Suid-Afrikaners wat die emosionele gewig dra. Skuldhulp is jou kundige skuldberadingsmaatskappy wat spesifiek ontwerp is vir trotse Suid-Afrikaners. Aangedryf deur die industrie-spesialis Debt Rescue met die hele proses van begin tot einde in jou moedertaal. Kry vandag 'n gratis assessering van Skuldhulp as jy sukkel om jou maandelikse skuldterugbetalings en lewenskoste te bestuur. Gaan na skuldhulp.co.za en begin jou reis na skuldvryheid. Skuldhulp, Afrikaans, regverdig, professioneel.
Deel ons passie vir die lewe op 657 Radio Kansel en 729 Kaapse Kansel.
Jy luister na Radio Kansel. My naam is Swangile Mofokeng and ja, my family, ek is hier tot 11 uur. Op 11 uur, I will say goodbye to you and Germany. Jenny Velsa will come through with perspective. Ek is nie alleen, ek is met Dr. Tlailani Onses op his besoek met Dr. Tlailani, and you can sommer praat met ons. You can just send a WhatsApp on 0826572729. We're talking checkups, and we are also awaiting to hear what you'd like us to discuss in 2024. Give you the sounds of Praise Peterson, Hallelujah, Yahweh, and it's 26 minutes just before 11. And here's one, and she says, hello, dear. I experienced this last year, so I haven't healed properly. That's you see my side of the mouth and eye still like this has drooped. I'm still in the process of healing. And she says it is Bell's palsy. So she sent also an information a little bit about it, what Bell's palsy is all about. So Dr. Tlailani, I think we need to note that as well here.
Okay.
It is. And ke a tseba gore le ko baptisi ka mokana ga lena. And I think ko moruti msisa. Yeah. Ke a tseba, man. I'm good. I know churches.
Good. You know Baptist, you don't know churches.
I visit churches le radio for
Yeah, that's right.
All right. So Bell's palsy, we have noted it, and then we'll make sure that we talk about it, my family. And I see another one here. All right. Shalom J explains that the son who experiences tiredness is not the one with tonsillitis, but I think you responded to both, right?
Yes, that's right.
Yeah. And then another one says, good morning. Please advise blood test for 18 years old. My 18 years old son reflects liver count 5 times the normal. Advised another blood test in a month. He does not drink a lot of... So it's a question. What does it mean? Does it mean he doesn't drink a lot of water? Is there a cause for concern? Thank you. Regards. Blessings. And this is EB.
Now, I think there's a cause for concern here.
Yeah.
With elevated liver count at that age, it's not good because we don't know what's happening to the liver. I think you must just see, okay, he's almost an adult. You must see a physician.
Okay.
And then the physician will perform what you call an ultrasound of the liver to see if there aren't any abnormalities in the ducts of the liver, you know, the bile ducts. And then also check if the gallbladder is not enlarged. Because for the elevated liver enzymes, it means there is some damage in the liver. The liver cells have been damaged. So I think it's very important that they must go and have this ultrasound to check, you know, if there is anything.
We're praying for God's best
if they
as you're going there.
If they can't find
anything,
then you can do an MRI.
Okay.
An MRI is in fact more informative.
It will tell.
It will
Exactly.
tell
It will go to the spots.
That's right.
And identify.
Yeah. And then they can treat the patient for the liver problem, whatever the outcome will be in the investigation.
All right. We wish them all of God's best. May they not go alone, but may they go with the Lord. So it shouldn't be a thing where we say as parents, no, he'll be fine. No. We should take it further.
And then just to answer, there isn't any further blood test that one can do.
Okay.
except those liver enzymes, because the liver enzymes, you can diagnose exactly what type of pathology that liver is suffering from.
All right.
Yeah.
EB says thank you.
You're welcome.
Yeah, go with the Lord. Shalom J says, Spongile, you can poke the big capsule with a needle and pour it over your salad. It's another way of getting it in. No. When I think about the smell, fish oil. You know, when I was in primary, I used to sing in the choir.
Yeah.
Hey, they used to give us fish oil as raw as
As it
is.
is, yeah.
Yes, so to clear our voices. So
So they
me and fish oil, Lord
But
have mercy.
anyway, you know what? Don't do that. Don't poke it. There is a reason why it's in a capsule.
It's encapsulated like
Yeah,
that.
That's right.
Uh-huh.
You see, when you swallow any tablet,
Yeah.
it has to go through the stomach, and then there's a lot of hydrochloric acid in the stomach.
Ah,
Now, what's going to happen is the capsule protects the.
it has to delieve
Yeah, it has to. No. The capsule will protect the what you call the
stomach.
the inside the omega inside.
Yes, okay.
So that it's not destroyed by the
Before
acid,
it gets
before
to where it's supposed to be.
because it can only be absorbed in the intestines.
So with all the capsules, because you've
No,
heard,
all the capsules don't
yeah,
dismantle
we've
them.
heard others saying just open it.
No, all that get destroyed in the stomach, and then
You don't get
you don't
the
get better.
nutrients
the
that you
nutrients,
need
whatever
from.
You want, yeah,
Oh,
it's not
okay.
good.
Shalom Jay. You heard it.
Yeah.
I was only concerned about the smell. Oh Lord, have mercy on me. The fish oil smell. But yeah, I still have I have omega 3s, but I don't know when do I drink them. I think
We had to to stay with this smell. When at med school,
Yes.
we are right in the
Yes.
front there.
Yes.
The smell from the sea.
So it's
just-
Oh, normal now.
So even the smell is adapted now. You don't feel anything.
You don't feel anything. You're immune to the smell. All right. Pastor Glory, hello. Saying, hi, Swangile and Dr. Tlailani. I need your help about treating or curing an excessive acid in the body. Yeah, if you're too acidic.
Yeah, okay. Let's say it's acid in the stomach, not in the body.
Okay.
Right. If you have acid in the body, it means you're acidotic, then you're very sick. You're in ICU that time.
Okay.
Now, any metabolic disorder, if it's not taken care of, you're going to go into an acidosis. Now, that you can treat in ICU because you may even have lost consciousness. But now, with the acid in the stomach, that one is easy. What you can do is you give antacids. There are those ones which we call H2 receptor antagonists, and there are those which are called PPIs, which is proton pump inhibitors. They inhibit the production of the acid in the stomach, and then that will also help you heal your ulcer if you've got an ulcer, and then it will also help you with the symptoms of what you call GERD, gastroesophageal reflux disease, when your stomach hangs into the chest, letting the stomach contents to go into the esophagus and then giving you that heartburn. So the best is to take antacids.
All right.
Or the PPIs or the H2 insert.
And so I understand if the gut is acidic, if your stomach is acidic, then it can cause a whole lot of eruptions on your skin. You might have infections on your skin, on you everywhere.
Yeah,
it can
that's
affect a lot. So what about the blood? Because I think when one says the body, you're thinking when a blood, so it goes into the bloodstream.
Into the blood, yes. Once it
that's why you'd have the eruptions everywhere.
You shouldn't have acid, too much acid in your blood system. It's too dangerous because it's going to intoxicate the brain, and then you can easily be unconscious. And that's why I say a patient who's got acidosis. Now I'm talking about patients with renal failure, for instance, because with renal failure you are not able to control your acid base mechanism
because there is no
the exchanges are pocket, yes.
Yeah.
And then even if you have got something like a liver failure,
Yeah.
You're not going to be able to can control your acids, and then it's going to go up. So those are really serious illnesses. If you've got them and then they are causing that acidosis, which will, the layman will call it too much acid
Yeah.
in the body. You should be in ICU.
Okay, so but now when you see things like the infections that do not heal, your seborrheic dermatitis and all such, you should be concerned.
You should be concerned.
Because it might go higher than where it's at.
Correct. Yes.
Okay.
And then when it comes to infections, usually,
Yeah.
if you don't respond to antibiotics,
Yeah.
there is what we call blood culture that can be done.
Okay.
Yeah, and then if you visit your doctor or you're in a hospital setup,
Yeah.
they will do the blood culture and they will isolate or identify the organism, and then they will culture it and then give you an antibiotic which will be able to attack that microbiome.
I'm very passionate about this one.
Is it?
Dr. Tleledi, you know that Prosper had an acidic gut.
Oh, okay.
And,
All right.
and
Yes,
which
yes.
affected him, and he would have seborrheic dermatitis and some infections that would never heal.
It's all a syndrome,
Yeah.
And then one calls this one and that one calls
And
this
then
one.
and then they call the cousins come,
That's
and
right.
it's
They
a
become-
mess.
yeah,
It's a mess. And I remember that heavy metal was found in his gut. Heavy metal parasites were found in his gut. And parasites. Yeah. He had worms, parasites, heavy metal. I forgot the fourth one. And he was
In the gut,
in the gut, and he was too acidic. So because the doctor would prescribe everything to put on his head behind he had sores.
Yeah.
The sores never healed for years until they
not-
took the blood, and it was the issue in the gut that was affecting the blood.
The whole
So I'm very
thing, yeah.
passionate. And I see that a lot of family members are asking about the same question. Limiji says, morning Spoon family, what should I take to clean my gut? I have lots of acid. It affects my face and body. Exactly what we're talking about.
But I don't believe in cleansing your body.
Yeah.
But you
It's just
can.
healing the gut.
Yeah. Don't go taking pegatives and other things. Because-
Just heal the gut.
yeah. That's right. But well, if one is used to that, then continue.
I
to
think
that.
I think how we grew up, I learned later that you shouldn't even use your laxatives.
Yeah. you
No.
shouldn't.
But you can eat something that will help your gut to cleanse, or your body to cleanse itself.
Yeah,
So
let me tell you something.
So how
Then-
does he heal the gut? What do you advise? The anti-acid?
Probiotics.
Okay.
That's what you should use. Because there is a paper presented by a certain professor who was giving us a talk on microbiomes of the colon.
Yes.
Yeah, those things are very important. And then when you take pegatives or you take enemas and everything, you disturb the microbiome of the colon. And then microbiome of the colon are very, very important.
Yeah.
And then there is also a new finding of having to resort to vegan diet to control the hot flushes.
To avoid your meat.
Yeah,
Because-
vegan diet, yeah.
Yeah, vegan diet, no meat,
No meat.
nothing from an animal.
Yeah, nothing that moves.
Fish, yeah.
Fish, yeah. And then,
Trees moved. Okay.
yeah. Now, it has been found that if you take that vegan diet,
Yeah.
it improves your microbiome in the colon. And then that somehow helps with the hot flushes. It manipulates the hormone balances.
Wow.
Yeah. So it's a new thing which has been discovered. I just read
Wow.
it on a SASOC paper.
So you are vouching for probiotics.
I'm vouching for probiotics. Yeah.
Well, I know that
Instead
they
of,
take-
spitting and all these things.
I know that spading. I know that they might take about 3 days to settle in the body, like for the body to get used to them and start working,
Yeah.
or depending on the strength of the probiotic
The
that you're using.
probiotics,
So what's the difference between the pros and the pre's? Because we also have prebiotics and probiotics. Are they the same thing?
I think it's the same thing.
Oh, okay.
Yeah, it's the same thing.
But it's just to have layer the culture in the stomach, to have
stomach,
a healthier
Yeah, it's
stomach.
to protect those microbiome
Yeah.
that the body needs.
Yeah. Sure. All right. Limiji, I hope you've heard Naki Kwe Chivatung. I hope that you also got something. Evie is back. Another question, please. Does the thyroid get tested or treated? I'm not quite sure. Tested with the basic blood routine test?
Yes,
Yeah,
you
it's
can do that.
tested because I wasn't sure because it says there's a typo there, and it says also what is recommended treatment for excessive acid. Much appreciated. Thank you for your advice.
I think we've answered that. Excessive acid, the treatment. We have to take antacids.
So, could it be triggered by the thyroid gland?
It's a bit far-fetched. You know, the thyroid gland is that gland in front here, which
Yes.
produces thyroxine.
Yeah.
Now, thyroxine's job is to take care of your basal metabolic rate. That is, it takes care of how your kidney should function, how your liver should function, how your heart should be beating. And, you know, if the thyroid gland hyperfunctions, then you are going to get what we call thyrotoxicosis, and then you are going to be in a very, very lethargic state. More longer, you're hyperactive all the time. And then you can also exhaust yourself. More longer, your muscles are going to start breaking down.
Sure.
And then they'll produce those...
When do you know it has to do with the thyroid?
pardon?
When do doctors know this has to do with the thyroid?
Well, they investigate.
Yeah.
Investigate.
Yeah,
And then it's one of the things that we have to do, a test that we have to do.
Yeah,
Yeah.
I know two people. The first one, the thyroid make them eat a lot.
Yes,
He
that's
would
right.
eat your meal, my meal, like 5 meals in one, and he has to eat every hour.
Yeah.
But he's not gaining any weight.
Anyway, that's right.
And then when he stops eating, he gains.
Yeah, that's right. Now, but one other thing that is very dangerous about this is that it can cause you myocarditis. You know, the inflammation of the heart muscles.
Yes, that's why I'm
Yeah.
touching here because
Yeah, which will lead you into heart failure, and then, you know, if not if not picked up in time, you know, to give you an antithyroxine, that heart will fail and then it can demise. You know.
and I understand that the thyroid can get cancerous as well.
Yes, yes. Fortunately, it's a bit rare. What you usually get is a goiter. It's a benign enlargement. It can be one single nodule inside the thyroid, or there can be multiple. And then
Yeah.
the treatment there is just to give you thyroxine to reduce it in size a little bit and undergo surgery to do what we call partial thyroidectomy, not removing the whole thyroid because
I
you
hear
still
you.
need a little bit of thyroid.
Yeah. And you still need to go for these treatments. But what I love about the one that I know, actually 2 people who have had this op made on the thyroid.
Yes.
Every 6 months they see their doctors
Yes, that's
to
right.
see if their blood is thinning because
Yeah.
of the medication and they need to
Correct,
change.
yes.
That is like really great
And
to
then
know
the,
that.
the lovely thing with the thyroid is
Yeah.
that after you've gone through surgery and have had supplements of the thyroxine, at a later stage, when you age 65, 70, then it goes away. You don't need to take any more supplements.
Really?
Yeah,
What?
that's what I like about thyroid. It's not permanent. Why?
Oh, I thought it's permanent.
No.
I thought, for the rest of their lives. Okay, that is like really awesome to know. Dr. Tlelan, we took you out of your teaching today when you're teaching about the, what do we call them again? The medical checkups.
Yeah.
But
then,
as we are closing, what do you say to family on medical checkups?
I think if you haven't been to a doctor for a checkup, whether you are ill or not ill, please go and see your doctor, like tomorrow or today.
All right.
Yeah, just
A
call,
quick
make
one.
an appointment. And,
A quick one, because we left with 1 minute actually.
Okay.
Pastor Khomoso would like to know, does a person with bad breath, such as tonsillitis or oral health problems, ke utlwile something also
Yeah,
about
both.
munyetsane? What about
no,
munyetsane?
both. They do.
What
They do
about
cause-
munyetsane?
I don't know what means.
They say somebody might be injured in an accident and then they start smelling. I know somebody who had an accident and she was injured on her neck. By God's grace, she's walking again. Now she has that smell.
No, I have to investigate. I don't know.
Please
anything.
investigate.
Yeah, I'll do that.
Okay,
I'll
so
check.
it can be. I know tonsillitis does
Yeah,
smell bad.
tonsillitis and then poor oral hygiene.
Yeah.
And then bronchitis, chronic bronchitis.
Ah, the
Mucosa.
chest,
The chest,
as
yeah.
well because of the soldiers. The, what do you call them? Masole a mmele man. What do we call
Antibodies.
it? Antibodies fighting, and
yeah.
then they causing the mucus.
The mucus, yes.
Yeah, they're fighting the infection. So when you speak, it might smell a little bit bad
That's
as a
right, yes.
result. All right. And Pastor Glory says, well comprehended. Thank you. Thanks a lot, good people, and much appreciated. And I would
you.
say much appreciated to Dr. Tlelani and the family. Thank you for being with us this morning. And thank you, Dr. Tlelani, for making sure that we learn these things and we take precautionary measures. We love you so much. A beautiful 2024 to you, Dr. Tlelani.
Thank you very much, and to the to the family out there. I'm looking forward to being with you again.
And I did promise that we will bring more doctors.
Yes, that's right. Must bring a psychiatrist.
Yeah, all of those. Do you remember that Dr. Tlelani's numbers are 078 738 2694. 078 738 2694. Limiji, I've just dropped that in your WhatsApp, and go with the Lord to the office. Be safe out there as you will be driving to the office. Germany, Yanni Pulsar is on the other side. Happy New Year, Germany.
Thank you so Thank you so much for that. That is really a privilege, and I'm happy to see you, and happy to hear the other listeners taking part in the program. And we're going to talk about the matric results and how we should interpret the matric results and so on. So I really look forward to the program ahead.